Heidi Otway, your host for this Conversations on Cannabis virtual forum brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. In this conversation, we're talking about the increase in people turning to medical cannabis as a treatment for cancer. So let's talk and learn about this subject with our guests. Dr. Johnny Bernard is a board-certified radiation oncologist specializing in treating cancer with radiation. Dr. Bernard has published numerous articles, research articles on cancer, and he's a qualified physician under Florida law who now integrates medical cannabis for his patients. Dr. Bernard, welcome to the forum.
Thank you.
Dr. Mandeep Singh Shagdeva is a professor of pharmaceutical sciences at Florida A&M University. He is a recognized leader on drug delivery and has published nearly 200 articles and given nearly 300 presentations worldwide. In his role as a section leader of pharmaceutics at FAMU, he is now leading research on cannabis and cancer. Dr. Mandeep, welcome to the forum.
Oh, thank you so much for inviting
And
me.
Glad to have you. And our other guest is Stephanie Suriel, a cancer survivor who will be sharing her remarkable story about using cannabis as a treatment. She now holds a Master of Science degree in medical cannabis, and she's working to pioneer medical cannabis therapies for young adult cancer patients. Stephanie, welcome to the forum.
Thank you.
To everyone joining us on this live program, please share, post, and tag a friend on Facebook to have them join this conversation. If you're watching on YouTube, share the link so others can join us as well. During the forum, we want you to send us your questions in the comment box, and we'll do our best to have our guests answer them. We also want you to tell us what you think about this forum by completing the survey that will be posted in the comments on YouTube and Facebook after the live program. Your name will be entered into a drawing on November 9th, 2023 to win a $100 gift card provided by one of Mary's partners. Now, let's start this conversation on cannabis. So here in Florida, medical marijuana is legal and cancer is a qualifying condition. So Dr. Bernard, tell me what prompted you to get involved in recommending medical cannabis as a treatment for your cancer patients?
So, Heidi, I actually did not believe in cannabis at all as medicine until I started working with cancer patients. But a lot of my patients were using it, and it was illegal at the time, but they were using it to help with various different issues that they were dealing with, such as cancer pain or helping to increase appetite or helping with nausea, vomiting. And they were getting very good results from using it. And I kept hearing the same story from patients over and over again throughout the years, until I slowly but surely became a believer in it as medicine and wanted to help them do this legally once it became legal in Florida.
Interesting. Thank you for sharing. So, Dr. Mandeep, I want to hear about the research you're doing regarding medical cannabis here in Florida.
Yeah, sure. It so happened I was very intrigued with cannabis and wanted to just try it out in my lab and see all the hype I'm hearing is true or not. So I, got in some CBD in my lab, and some companies gave me as a gift, and I got some CBG in my lab and started testing them against tumor cells. And in my lab, I have a variety of tumor cells: breast cancer, lung cancer. I have also resistant tumor cells in my lab too. And when I started testing them, I was really amazed that how CBD and CBG and CBC, they could overcome resistance of doxorubicin resistant breast cancer cells. That a cell line which has a 30 micromolar IC50 gives the number 30 for doxorubicin. CBD or CBG were doing at 5 micromolar or 2 micromolar, like 100, several folds of improvement. So that's how I started. And then I went deeper into it, went into neuropathic pain, work with resistant tumors, then work with delivering the cannabis by different routes. It could be oral, it could be parenteral, and it could be topical or transdermal. So that's how my journey started. And now I have published a few papers and a lot of work, and thinking to do a clinical trial in the future if everything goes well.
Yeah, that would be fascinating. We were going to talk about that too. And Stephanie, I shared earlier that you're a cancer survivor and you have this remarkable story. Can you share that with our listeners and viewers today?
Yes, to clarify that I'm cancer thriver as I'm still living with cancer actively today. So as of November, I'll have had metastatic cervical cancer for 5 years. November 13th, 2018, I was diagnosed metastatic and incurable as I had several tumors throughout my abdomen, the largest being 17 centimeters attached to my left ovary. It was inoperable and radiation was not going to be an option. So I began chemotherapy 24 hours after my diagnosis. And they gave me the standard opiates and benzos combination that they send patients home with. And the entire weekend, I was completely detached, dissociative, can't remember much other than feeling terrible because of how beat up and nauseous my body felt on the opiates, especially, and how dissociated I just felt from all emotions or anything at all, good or bad, from the benzos. Because of the diagnosis I had, I knew that it was going to be a marathon, not a sprint. And in order to get through that, I was going to need something that actually allowed me to be present in my life and, enjoy being present in my life because, I'm not dealing with nausea or vomiting or everything else. I had already had some experience with cannabis. I wasn't really a recreational user, but I did have a roommate that was a veteran with PTSD who had started a coalition in Southern California. When we were roommates, he would use it to help him with his PTSD and sleeping. And he fully educated me on, he's the first person that I learned about the endocannabinoid system from and educated me on the different ways that it worked throughout the body. So when I got diagnosed, I immediately decided after that first weekend with pharmaceuticals that it was not going to be for me. And if I was going to get through this, that I needed to try something else. And I immediately just dove in and found out as much research as I could about cannabis. And by my next cycle, I had settled on doing one-to-one throughout the day. So one-to-one THC to CBD that I was able to get at a local dispensary because I'm in Massachusetts. And the medical dispensaries had just opened that first year in 2018. And one happened to be right around the corner for me, as luck would have it. So the one-to-one THC is what really completely changed everything for me, where I wasn't dealing with nausea. I was eating. There were times where I would truly forget that not only was I a terminal patient, but that I had just had treatment because I was able to be so present with my daughter and with my niece and my nephew and with my family. And the quality of life that I have been able to maintain for 5 years is one of the main reasons why I've been able to keep such a strong outlook while dealing with being in treatment for such an extended amount of time.
Yeah. Dr. Bernard, thoughts on that remarkable story and your experiences here in Florida?
Very remarkable story. So anytime you have a person who has metastatic disease, you're always concerned about the length of time a patient has, even though as humans, we all have some predetermined length of time, but you become more concerned about it instead of metastatic disease. But the fact that she's been able to live with that for so long is truly amazing.
Yeah. And Dr. Mandeep, in your research, I mean, are you seeing evidence of cannabis allowing patients with, cancer patients with these type of diagnoses actually live a higher quality of life as Stephanie is right now?
Well, I mean, since I'm not a practicing physician like Dr. Bernard, but there are a lot of anecdotal data out there. But that's the big issue we have, that there are not too many clinical studies being done with patients, or there's not enough documentation available to put forward to the public, hey, this really helped you. But working in my lab with animal studies which have tumors in them, and I'm more interested in tumors which are resistant to therapy, to Taxol, to doxorubicin, or all these anti-cancer drugs. How do we treat? Because that is a bigger problem than wild-type tumors. And we found that in our combination we use of the cannabinoids, I believe in the entourage effect, as Stephanie mentioned. Combination is where it works the best. And we are learning a lot more about new combinations. So I found that when I use the right combination, the tumor does not grow anymore. It just like stalled while the control is growing and growing and growing, and that tumor size is just stalled for the rest of the time period. So that shows that this needs to go to clinical trial. But the big pharma is not interested much in that because there's a lot of discussion about is this really a drug or just really a over-the-counter remedy or anecdotal evidence. So
Mhm.
until more studies come out and more clinical data is generated, there won't be a big pharma jumping onto it. They are talking about it, they are thinking about it, but they haven't taken a jump yet.
Mhm.
But I feel that there's a big need of more clinical data to be available to the public or to be published. We need to do more studies to be done. And also, whatever data we have got out there scattered, we can put them all together. That'll be
Mhm.
a great thing for the public. So, all these things are hindering the benefit the public can really get if
Mhm.
we can get to them.
Yeah. So, Dr. Bernard, when you're recommending cannabis to your cancer patients, Stephanie mentioned that she's found what works for her. How do you work with cancer patients here in Florida who come to you and say, hey, I want to try this? What's the process for them when they come to a qualified physician in Florida?
So the process to obtain a card is exactly as you said, Heidi. They have to see a physician who's qualified under state law to actually evaluate them for the card. So I am one of those physicians, and we have over 2,500 physicians throughout the state of Florida.
Mhm.
And you can find those physicians on the state website. If you Google Know the Facts, MMUR, Medical Marijuana Use Registry, it'll come up. And you can search for a physician there. I'm located in the Palm Coast area. Patients can be referred by their physician or they can come directly to the physician.
Mhm.
And most physicians would like some sort of medical records to confirm diagnoses, but we as physicians can also diagnose ourselves. But that would be the first step to make sure that they have a qualifying condition under Florida law. There
Mhm.
are conditions specifically specified in Florida law, such as cancer,
Mhm.
PTSD, HIV, AIDS, Parkinson's, Crohn's disease, multiple sclerosis, things that are very, very debilitating to most people. But then they also have a section called other debilitating conditions as well, such as things like arthritis or migraines.
Mhm.
Um, and conditions have to be similar to ones that are already in the law. So people with anxiety and depression, that's similar to PTSD.
Right.
So people who have epilepsy is a qualifying condition. People who are not diagnosed with epilepsy but have seizures, that would be like that. So they could get it as well. So
Yeah.
there are a lot of, because of the way Florida law is structured, conditions that could potentially qualify people as long as it's similar to something that's already in the law.
Right. So they get the registry card that says that they're allowed to go to a Florida dispensary and pick a product. And so I'm going to kind of lean to Stephanie a little bit because Stephanie, I'm sure that where you're located is kind of similar, where you get you have a qualifying condition, you go to your dispensary, but then how do you know what to get?
Oh, I'll never forget my first trip to my dispensary. It was so overwhelming. With all the research and the decent amount of knowledge that I had before getting in there, like I can't imagine what it would have been like had I gone in there completely blind. I had lucked out that the very first, patient advocate that I spoke to was extremely well educated and knowledgeable, and he took 90 minutes with me to help me find a strain that was going to be high in the terpenes that I was looking for, and like helped break down everything that I didn't understand as well with all of the different concentrates and making sure that I was staying away from high THC so that I wouldn't overexpose myself to potency too soon, and really pushing me towards full spectrum entourage effect and whole flower.
Yeah. So, Dr. Mandeep, in your research, we were talking about, you talked about CBD, CBG. We talked about the endocannabinoid system and all these terminologies. So, in your research, can you share if there were different modes of giving cannabis to in your lab research that you saw a difference, or how do you test it in your lab? The different types of cannabis. Is it oil? Is it? I know rats can't smoke, so I'm just curious. How do you get it in there so you can do your testing?
Well, we to start off with, cannabinoids are absorbed very poorly. They have a poor bioavailability. So you have to, the oils sort of on the market to be taken sublingual. There is a lot of compliance issue with that, and also there's a stability issue. That moment you open the bottle, expose it to air, the oxidation will start. So you have to be very careful that you don't store the bottle for months and think that it'll be effective after 30 days as it is today, because you're going to keep losing its value the moment you open up. Air goes in and it starts its job. So that part is there. However, they have come with synthetic CBD, synthetic CBG, which is now available. So the trend is to go towards synthetic. Even one of the TSC on the markets are synthetic.
What does that mean? The synthetic. You're saying synthetic.
That
okay.
means that they have been made in a laboratory synthetically by chemical reactions.
Right.
They know the structure. We know all the structures of all cannabinoids, so you can make the same molecule. Just like we have on the market synthetic Taxol. So now they make it by a different method, but we had for a long time synthetic Taxol. Same way we have synthetic cannabinoids being coming out. However, from all the formulations on the market, I think gummies have the best probably outcome for the oral absorption. If you really compare, because gummies somehow protect some degradation in the GID. So that's one way. However, the lot of studies they're done with the patients in clinical trials, they gave a route of IP route was commonly used for a lot of patients. You can give it intraperitoneally. It's absorbed well that way. If you want to give mixture of cannabinoids, there are a lot of transdermal delivery systems being developed, but the one on the market are over the counter, so they are not really very well studied. But I know a lot of dermal pharma companies are trying to make patches which can really deliver a good amount of cannabinoids across the skin into the bloodstream. However, it's important to use a cannabinoid which is effective in lower dose, right? And that's the most important part we're looking into. That's why the combination of 2 or 3 cannabinoids, which can reduce the overall effective dose required, will be a better way to work with a transdermal delivery system. Well, there's another way to give it through intranasally. If you have brain tumors, the best route to give it from a nose to the brain through the olfactory and the trigeminal route. So that's another area where you can look into having a intranasal spray or intranasal gel or whatever you want to make it, a formulation which can go in the olfactory region and take it to the brain, so that patients with brain tumors, especially children, for that there's no cure for some tumors. Maybe this can help, but all these things have not caught up yet that much. These are things we are doing in research to develop better formulation through different routes available to us. And maybe you can make suppositories of cannabinoids for systemic absorption also. That probably I see some of these on the market, some products. But again, you need a very good formulation development team to address the issues of refining the absorption and kinetics of those products. For all these ideas, we are toying with in our laboratories and have published with some of these strategies. Or you can make a delivery system in some nanoparticles, and deliver more effectively. So all these are things we have been trying to work, and other scientists trying to work while working in this space.
Yeah. Dr. Bernard, did you want to add anything about that, about the different modes of delivery and also the dosing question? I mean, we hear a lot of that from folks who write in or respond to this show asking about dosing. And Stephanie, I want you to talk about that as well. But Dr. Bernard, did you want to add anything to the conversation about dosing and the methods of delivery? for cancer
Yeah,
patients?
we already have intranasal sprays that people can purchase from the dispensaries. And suppositories were available when we first started, but there was not a lot of demand for it. So
Mhm.
most of the dispensaries actually don't have it at this particular moment, but they are um, available. We just may not necessarily have them in our dispensaries.
Mhm.
So there's pretty much any way that you can think of it being done. IV therapy is not available at the moment, but I do hear there is a company that's developing a method to um, be able to do IV CBD. It has a lot of issues with being able to be small enough to go through an IV, but there's a
Mhm.
company developing a method for that as well.
Mhm.
So a lot of different options out there in the dispensaries already.
Yeah. And Stephanie, I would imagine that depending on someone's cancer, whatever that is, dosing is going to have a big impact on how they feel. So can you talk a little bit
Oh, for
about your
sure.
experience with dosing and then also the modes of delivery that you found effective?
So my modes of delivery definitely have changed. One of just through the surgeries that I've had. Prior to my surgeries, I used to enjoy doing tinctures like under the tongue or edibles. Now my absorption, it doesn't work as well. So I prefer dry herb vaporizing or just smoking a pre-roll myself. And for me, I find smoking the full flower gives me a longer effect throughout the day. So I'm able to smoke a pre-roll in the morning, and then I'm not needing to medicate again until 12:30, 1 o'clock around lunchtime. And then and it's probably going to be in one day, I'm probably smoking 1 gram, like 1 gram of sativa to get me through the day. And then I'm going to smoke maybe half a gram at night to sleep sometimes, not even always.
And did you have to figure out the dosing yourself? Did you work with your physician to determine the
No,
dose?
for me, it was working with myself
Mm.
and really paying attention to what made me more productive, what's giving me an appetite, what days am I eating more, what days am I eating less, what days are taking me longer to recover,
Yeah.
and and sticking with that. When I first started, I tried not to get too attached to specific strains because I knew that they might not have that the next time I go. And rather finding like the formulations that work for me, or knowing what terpenes that I'm finding that work for me, like myrcene and beta caryophyllene are two that I absolutely love having like in my strains.
Yeah.
And I mean, and I'm such a, you find me adding beta caryophyllene to everything. Like I'm throwing cloves in my smoothies and anise and anything I can. So to just up that, encourage that entourage effect. And, you'll catch me drinking, making a mango lassi 30 minutes before I'm going to smoke, so that the myrcene in the mango is going to improve the effects of what I'm about to smoke as well, because we can enhance that entourage effect through the foods that we're ingesting as well.
Yeah. So Stephanie, you got a master's of science, and I'm sure that we have some viewers and listeners who are, dealing with all kinds of, illnesses, and they're considering cannabis. So it would be great if, you could share with us, some of the resources that you use to kind of self-educate yourself, and we can share that with our viewers and listeners on social media and get that out to them. So thank you for sharing that. But yeah, what was your number one source to help you learn all these things?
Leafly and Leafwell were my number two. Like Leafly and Leafwell, I was just constantly on those two websites, reading as much as I could.
Okay.
And then once I got comfortable reading the science, I just started going straight to PubMed, straight to Google Scholar and PubMed. And then I just ended up in grad school. So here we are.
Here we are. Okay. So Dr. Bernard, we kind of talked about the research. We talked about, Stephanie's personal story, and everything we've talked about talks about the benefits. But, are there risks for cancer patients to consider using cannabis as a medical treatment? Are there any risks involved?
There's always risk with anything that you try.
Yeah.
Cannabis, those risks are very minimal, though. So the main risk that we worry about with medications is the risk of a lethal overdose if you take too much. So we don't have that risk with the cannabis. So it can cause some problems and make you feel like you shouldn't have taken that much, but there's no risk of lethal overdose because it doesn't affect breathing, which most medications would if you took too much and stopped breathing. But you can have some effects. So if you take too much THC, sometimes that can cause significant anxiety or paranoia in some people. Sometimes you can have heart palpitations. Sometimes you can have dry eyes, dry mouth from it. There's something called cannabis hyperemesis syndrome. If you're very consistent user and user of high amounts, that sometimes your body can eventually reject that, where you can have a lot of nausea, vomiting, and it happens every time you use cannabis. And the only cure to resolve it is to stop cannabis. So that's a risk of using it as well. Now, in people who are very young, like under 21, so if you go to most recreational states, you have to be 21 to use. But medically, you can typically get it at 18 or even younger if you have other physicians to corroborate your need. But in younger people, we are concerned with the brain still developing and potential for, a variety of different mental disorders, ranging from, depending on the age of the child, ranging from ADHD or schizophrenia developing later in life, or autism, things like that. So it all depends on how old they were when they are ingesting. So we don't recommend this to ladies who are breastfeeding or are pregnant. They can still do CBD, but not THC.
Dr. Mandeep, did you want to add to that?
Yeah, I mean, I do agree with Dr. Bernard that if you take less amount of THC, I know there are a lot of prescriptions where they have 50% of THC. And now, if patients take a lot of those formulations with high amount of THC, that can lead to a lot of the problems Dr. Bernard mentioned. However, if you keep THC under control and work with other cannabinoids like CBD and CBG or the terpenes, and I love beta carotene. I studied all the terpenes which are out there, and I found that number one was beta carotene, followed by myrcene. So I swear by that. The beta carotene is a fantastic terpene. You combine that with other cannabinoids, you can have as good a benefit as you can have with THC combination. So I try to use no THC in my formulations. I try to stay away from that for a variety of reasons. But I do agree that if you stick with the CBD and that area, the toxicity is very minimal. Of course, you can't give it to pregnant women and breastfeeding. That can cause a lot of other issues. So that part we are very clear on at this time in the scientific community. But other than that, I feel that the entourage effect, and not even to talk about humans. We all humans have pets. I healed my pet via cannabinoids, a combination with other drugs. So my pet was supposed to be like passing away in a month or two. That's what the doctor said. But then I put in my knowledge, put in the cannabinoid regimen in, and did accordingly, got the right formulation, as Stephanie mentioned, from the market, and voila, the pet lived a year longer. He just passed away. Right? So all I'm saying it is that cannabinoids have a lot of benefits we don't know about yet, and that's why we need more clinical studies to show the benefits. There's a lot of work to be done, the way I look at it, and we just scratch the surface at this point.
Yeah, Stephanie, do you want to add anything? I'm sorry, Stephanie.
May I jump in there?
Yeah, please.
Just for a second, just real quick. So we mentioned the term terpenes for a while, but I don't think we've defined what it is for the viewers out there. But terpenes are other ingredients in cannabis, and actually in other plants as well. But they're responsible and contribute to the smell, taste, and even different colors of the cannabis bud. And they do have other properties as well to help with different symptoms, such as helping with anxiety and depression and inflammation and that sort of thing. So just wanted to make sure the viewers know what we were talking about.
Yeah, great.
Okay, that. And Stephanie, did you want to add anything to what both Dr. Bernard and Dr. Mandeep just shared?
Regarding the dosage and combinations?
Yes.
Yes. And, now that I've been using medical cannabis for so long and 5 years in now, like I've, find my strains that I prefer and we grow them. And that, that creates a whole different relationship with your medicine and with yourself and with the dosing and with the plant. And it's a whole new empowering way to be as a patient, where now I'm completely responsible for my medicine from seed to ingesting.
Wow. Wow. So we talked a lot about, knowing what to take, the dosage to take, the strain to take, the method of intake of the cannabis plant. And I could just imagine that we have people that are cancer patients right now that are listening and watching and wondering, okay, I'm interested in trying medical cannabis to help me feel better as I go through this experience. I'm going to go to my, qualified physician here in Florida. But then, Stephanie, you referenced you walked into your dispensary and you're like, I don't know what, what? It's like overwhelming, right? So
Yes.
what advice or the best steps do you give someone who says, I'm going to do this and I'm going to go into a dispensary? What do they need to know? What do they need to do? Dr. Bernard, I guess I'll go with you, and then Stephanie, whoever wants to jump in on that, because that's a loaded question, but I'm sure someone is saying, I want to go in and I want to walk out feeling better. I don't want to feel high or whatever that is. What are the best practices?
So we have
go
ahead, Stephanie.
I would tell them to start with the lowest amount and go slow. Figure out whatever method of ingestion is most comfortable and familiar for them. Go with that, and then find the lowest dose that you can and go slow with it.
Mm-hmm. Dr. Bernard.
So we have a medical cannabis consultant on our staff that's trained by me, but also has a background in pharmacy. She was a pharmacy tech, and also she was the manager of several dispensaries throughout the state of Florida. So she has kind of like the pharmaceutical background and the cannabis background as well. Mm-hmm. But our patients get counseled by her on different strains, if they're looking for specific terpenes, that sort of thing. But we make sure patients know all the different routes that are available, about the different dispensaries, and answer any questions that they have. So that goes on within our practice. And then once they go to the dispensaries, a lot of the dispensaries do have people who are dedicated to providing additional advice about their specific products that they have in that particular dispensary, because there are thousands of different strains of cannabis and each one carries different ones. So our practice doesn't know what a particular dispensary would have. So that's where those dispensary workers come in to let patients know what they have in that particular dispensary.
Yeah. All right. Thank you for that. So then I'm going to flip the question just a little bit to another direction. So in Florida, recreational or adult use marijuana is illegal. But also, if you go into your convenience stores or the grocery stores or the gas stations these days, you're going to see and in stores in general, you see all these different CBD type products, right? The Delta 8s, the Delta 9s, cannabis infused beverages, the edibles and everything. So what if a cancer patient says, I don't want to go to Dr. Bernard. I want to just go in the store, pick up some gummies, go home and do my thing. Thoughts on that? What would you say to those folks who are considering that or wanting to do that?
So Congress passed a law that made hemp legal. So it can be sold legally within the United States, but that industry is highly unregulated. Mm-hmm. So patients could be getting CBD or whatever is claimed to be advertised on the label, Delta 8 THC or Delta 10 or whatever. But that's not necessarily going to be in the product. So there's no standard testing that these companies have to go through. So there was a news story a couple of years back. They went to like 10 different CBD places within the state of Florida and tested their products, actually went to a verified lab, tested the products, and only one of them actually had the amount of CBD that was advertised in it. And some of them didn't have CBD in it at all. Wow. So you never know what you could be getting, and they could be putting different ingredients in there to make you feel a high that's not necessarily going to be helping you, just to keep you going in there to buy their product. So I would advise people to not do it that way, to go to medical doctor, get your card, and go to our state regulated dispensaries, because they have to go through extensive testing to make sure there are no bad products in there, such as pesticides and all different kinds of alcohols that could be in there that could be harmful to you, like butane, propane, that sort of thing, which is used in extracting cannabis. Um, so you're going to make sure you get a verified product that's going to be healthy and safe by going to the dispensaries.
And they also have that certificate of analysis that you can just scan and you
That's
can
right.
see exactly what's in the product before you
That's
can.
right. And some places do have that. Some of them don't. But like I say, just never know what else could be in there that they're not telling you.
Dr. Mandeep, I saw you shaking your head while Dr. Bernard was talking. Did you want to add something to that?
Yeah, I want to add something to that. He's very right, and that there are so many products unregulated on the market, and I know every company has to do a COA for their product. Now, a lot of companies, what they do a COA for the CBD or the CBG or the various components they are taking, which is lying in their drum in the company. But when they make into a formulation, they disclose formulation contains this. But a lot of times they don't do a second COA, after they have made the formulation. That is that CBD still intact or not after they made through the whole process.
Wow.
Furthermore, like I'm going through IND, FDA wants a 30-day data of stability. They want to see today, and after 30 days, a COA. They want 2 COA reports. Nobody's doing that. So people are selling in the market milkshakes, CBD milkshakes, right? And people are paying extra money for that. CBD maybe is hardly much there. A lot of it has degraded in the process, lying outside and easily oxidized. So, and did a study. I went to a conference a couple of years ago. They were showing that all these milkshakes being sold, there's hardly much CBD left in there. So we are paying for basically a CBD which claims to be 100%, maybe 10% left over there, which won't do anything for you. So, bottom line that you must go to a regulated pharmacy or dispensary where they can educate you, because as Stephanie told, that education is the key. A lot of people don't have the time or I think the time, basically they have a desire but not the time to go there and research it, because a lot of them have so much pain or depression or anxiety or whatever. They just want to get better, so they try anything. So I think that with such loose regulation, that's where I think the missing link is, that if we could somehow educate people more or get more data put together from clinical data, maybe we can build more confidence through more publications, through more public disclosures that do this way and you'll get success. Like we know, if I take a pill of so and so, I'll feel better for my blood pressure or cholesterol. Something like that, if we can regulate that in that direction, maybe we can help a lot of people, because there's a lot of applications, as we just heard today, not only in cancer, in anxiety, depression, Alzheimer's, irritable bowel syndrome. There's so many applications. Neuropathy. I'm working with peripheral neuropathy through chemotherapy and diabetes. Yes, and also in the nerve regeneration. I'm working with a collaborator in University of Miami who works in spinal cord injury, and I sent her my formulation. It's my formulation I made of CBD in some exosomes, you can call it, and she saw. I said, wow, this is great. And so we are on a grant together to the DoD for spinal cord injuries to heal them with CBD formulations. So there's a lot of applications we don't know about, and a lot of research is going on and has to be done more to understand this.
Yeah. So Stephanie, I imagine in the work that you're doing with young people who have cancer, what are some of the questions that you're getting from them? I mean, we did a show recently where they said down in South Florida, they had, remember what, the ice cream truck, right? The food truck. And is selling these products, unregulated products, what we're talking about, the Delta 8s in an ice cream truck. So it looks like candy. It's the brownies and all that. So tell me, in your experience working with young people, I mean, what are the questions they have and what are they saying to you about cannabis use as a medical treatment?
The questions will be very similar. They'll ask about the ones like at the gas station, should I touch those? And, my advice is very much similar, that you don't know what you're getting with those. And it's going to be synthetic. It's going to be chemical. If it's even what it says it's on the label, because it's completely unregulated. And, just letting them know that it's still kind of the Wild West out here in medical cannabis. Even in the states that have a legal medical cannabis market, that overlap of like the CBD market and the lack of education of the general public of understanding the difference between the two, it can be very confusing. Luckily, most of the patients that I work with, we're in a fully legal state where we have medical dispensaries and we have recreational dispensaries.
Yeah. Yeah. Well, this was a really fascinating topic. And as we wrap up, I want to give each of you all the opportunity just to share some closing advice with cancer patients who are considering cannabis use as a treatment for them. So, Dr. Mandeep, I'm going to start with you, then I'll go to Dr. Bernard, and then I'll close with Stephanie. Dr. Mandeep.
Okay, great. I will advise any cancer patients is to first get it okay from your oncologist that it's okay for them to take cannabinoids. If they say okay, go ahead, it's your call. We have no concern with that. And I'll say that, hey, go to a dispensary, talk to the physician there, the pharmacist there, get fully informed, read up on it. It's your life, and you have cancer, and you want to live, and you can live. You can live a long life, free of cancer. If you just follow the guidance which these people give, plus your own reading, that also helps. So I think like anything else, if you want to lose weight, only you can do it. Nobody else can do it for you. That only works for short term. But in the same way, if you want to fight cancer, you have to fight it with you and your family and the help of these physicians and the pharmacists who are there to help you. That's all I would say.
Thank you. Dr. Bernard.
I would say come and see a medical marijuana doctor early, even before your cancer treatment starts. I've seen people go through cancer treatments using and people not using, and the people who go through it using tend to do much better than the people who are not, or just using, prescription medication. So I would say come early, and then even after your treatment, a lot of times there's still issues, not necessarily cancer related if the cancer is being cured, but sometimes there's issues relating to side effects from treatment that are still lingering, or sometimes just having a diagnosis of cancer leads to anxiety and depression and trouble sleeping, and the cannabis can help with those things as well. Mm-hmm. So number one, we want to improve quality of life for our patients, and number two, to be able to use one product to help treat multiple different issues that you're having versus using lots and lots of different prescription medications and getting on that never-ending spiral of needing more and more medications because of the medications you're taking causing side effects that need more medications to treat.
Oh my goodness. All right. Stephanie.
I would say go to a medical doctor or a medical cannabis doctor early. I would agree with that, before you even begin, if possible. And I would also say to go with an open heart and an open mind for yourself, and to have patience with yourself and with cannabis itself, because the first strain you try might not work for you immediately. You might have to try a couple times before you find what does work for you. And also be open to cannabis being not just healing for you, but it can be a healing communal medicine as well. Again, since I'm in a recreational place, what was really kind of beautiful about what cannabis also gave to me during my treatment is it allowed me to make my medicine a communal moment when I had my family with me. we would be able to sit and take that medicine in together and deal with the fears and deal with the anxiety and deal, I'm the youngest in my family of 4. I'm very loved. And, there's a whole lot of anxiety, and it's very hard to watch someone you love go through something when you can do nothing about it. But when you're able to sit there with them while they're taking a medicine that completely improves their quality of life and removes all the suffering related to what they're going through, that's really a beautiful moment that can bring you closer to those around you in what would otherwise be an extremely isolating and disempowering experience.
Yeah. Thank you all for this conversation. So Stephanie, Dr. Bernard, and Dr. Mandeep, I really want to thank you for being our guests on this Conversations on Cannabis virtual forum, brought to you by the Medical Marijuana Education and Research Initiative at Florida A&M University. Thank you to everyone watching this program. Tell us what you think about this forum by completing the survey that will be posted in the comment box on YouTube and Facebook after this live program. If you complete the survey, your name will be entered into a drawing on November 9th, 2023 to win a $100 gift card provided by one of Mary's partners. We also want to encourage you to go to the Florida Department of Health Office of Medical Marijuana Use website to learn how to obtain a legal medical marijuana card in the state of Florida. And we also encourage you to go to Florida A&M University's Mary website to learn more about this initiative, its educational programs, and additional information about cannabis use in Florida. Thanks, everybody.
Thank you.
Thank you.
Thank you.